excellent exhibition so far. We've had lots of quality visitors here. We've been very happy with the traffic. We've had some high quality visitors from South Africa and the surrounding countries, and for sure it's been very beneficial for Mackay and the Gettinger Group as a whole.
Africa Health this year has been fantastic for GE Healthcare. We've met a lot of good stakeholders in the markets, especially in sub-Saharan Africa, where we've got to meet some of our partners, some of our government stakeholders, ministries of health, and a lot from the private sector. So all in all, it's been a great show for us.
Dräger is participating for the 5th time in Africa Health now in 2015. The conference was definitely growing. We see more and more participants, we see more and more interested parties.
Stiglmaier Africa is very happy to be part of Africa Health 2015 for the 3rd time in a row. We've had a very good year at 2015 with the customers we've seen on the stand. We're really looking forward to be back at Africa Health in 2016.
We've actually noticed for a couple of years now that Africa Health is starting to get a lot more exposure. We're seeing a lot more feet at our stand, so it's an improvement, and I think it's going to carry on improving year on year.
I mean, the most important thing about the conferences is to learn what other people are doing better, also to be able to share expertise in the South African health system as it stands now. And not only do we see South Africans in the South African boundaries, but we see citizens of the continent.
And one of the things that Africa Health helps us do is to get healthcare workers to actually be aware of some of the problems that are prevalent in the society. When we look at it from the point of view of the impact of ethical issues and human rights on health care.
We start our medical video SD segment watches, can't we? Right? We need a whole new mind.
I think for me, being a hospital manager, we really are looking for equipment all the time. We want to see what is new out there in the marketplace. And something like this from an international point of view is fantastic.
The traffic to our stand has been of the highest quality. We've had people from all over Africa. We'll be back in 2016.
With the conference that I attended on patient safety, it's not like we don't know what we are doing, but we have learned a lot.
Our main aim is to try and minimize radiation to patients. So the better the technology, the lesser the radiation to a patient. So every year, in actual fact, I'm looking forward to coming to Africa Health.
What we've chosen to focus on in the 2 days of this conference are infectious diseases, because that obviously remains one of our biggest challenges, not just HIV but TB. The second challenge for me is the burden of non-communicable diseases, which can only get bigger.
We had a great experience so far. A lot of visitors coming into the booth, and we're very satisfied. Gettinger Group will definitely come back for 2016.
We've met probably the most innovative people in the South African and also from the entire continent of Africa. I think it's been a great conference to be at. You'll certainly see us again next year.
I think it's achieving what it should be from a manufacturer's point of view. I also think that a lot more focus from your end customers or your end users are picking up in terms of volume.
Having this kind of support from Africa Health has twofold benefit for us, not only the financial help that we're going to be able to give to more families and help clinics in outlying areas, but also the focus on clubfoot as a treatable disability and the fact that this help is out there for people.